Welcome back everyone. Myself Rekha Mani and my ID number is 9840 and my assigned topic is Importance of Rumen Motility, Rumen Fluid Examination and Transformation. First let us discuss about rumen fluid examination. Examination of rumen content is often essential in determining the site of rumen environment and digest. There are different methods of collecting the rumen fluid. There are the stomach tube method, needle puncture of the rumen fistula and ruminocentesis. These are the methods of collecting the rumen fluid. Examination of rumen fluid. There are three types of examination of rumen fluid: physical, chemical and microscopic examination. Under physical examination, color, consistency and odor. Under chemical examination, pH and methyl blue reduction test. Under physical examination, color of the rumen fluid. Usually the color of the rumen fluid, it ranges from the green, olive green to brown green. If the cattle is fed with a pasture, then the color of the rumen fluid will be dark green. If it is fed with a silage, it will be yellow brown. If it is fed with a grain overload, it will be milky green. And in long duration with putrefaction, it will be greenish black. Consistency of the ruminal fluid is normally slightly viscous in nature, and watery rumen content will indicate the inactivity of bacteria. Excess froth will be associated with a frothy blot as in primary ruminal tympani. Odor of the ruminal fluid. Normally the odor will be aromatic, and rotting odor it will indicates the protein putrefaction, and sour odor will indicates the excess of lactic acid formation. pH of the ruminal fluid. The pH of the ruminal fluid varies according to the type of feed materials and also time interval between the last feeding and the taking of the sample for the pH examination. The normal pH will range from 6.3 to 6.8. The IPH value will range from 8 to 10 and the low pH value will range from 4 to 5.5. Under microscopic examination of ruminal fluid, it is done by taking few drops of ruminal fluid in a glass slide with a low power field, which will reveal the level of protozoans activity. Normally it will be 5 to 7 protozoans are active per low power field. Lactic acid, the protozoans are usually absent or low or sometimes even dead. These are the different colors of the ruminal fluid. Next topic is about the transformation. It is nothing but restoration of the ruminal microflora. It is the process of transferring the rumen microbes from an healthy donor cow to a sick recipient cow. It can be done in two methods, oral drenching or by stomach tube method. This is the stomach tube method of transformation and it is the oral drench method. Next is the importance of ruminal motility. As we all know, the rumen is the largest compartment of the stomach that fills the left side. It is also referred to as fermentation vat, and microbial digestion takes place in the rumen, and it can hold up to 95 kg of the ingested feed materials, and the pH ranges from 5.8 to 6.8. And the microbial digestion of the carbohydrates will produce the volatile fatty acids that are used by the animals. Motility of the rumen. The rumen is always contracting and moving. Healthy cow will have 1 to 2 rumen contraction per minute. This contraction helps in mixing the rumen content, bringing the microorganisms in contact with the new feedstuff. It also reduces the flotation of the solids and moves the materials out of the rumen. Lack or decrease in the frequency of the rumen movement is one of the way to diagnosing the sick animals. Types of ruminal contraction. There are two types of ruminal contraction, primary contraction and secondary contraction. Primary contraction is also called as A wave or backward moving contraction. In normal animals, there are 1 to 2 contractions per minute. Secondary contraction is also called as B wave contraction or forward moving contraction. It is usually occurs after the primary contraction. This was also all about my topic. Thank you.